Let's talk about schizophrenia with leading psychiatrist.
I'm Dr. Tina Gupta, psychiatrist. We are talking today about schizophrenia on account of World Schizophrenia Day, which is around the corner. Once some member in your family gets diagnosed with schizophrenia, it could be very, very heartbreaking. It could be the onset of a lot of questions, queries, doubts, and fears. While even now there is no cure, no perfect cure to control this condition, but still it is possible to live a happy life with schizophrenia. There are many effective treatments which are best provided by a team of providers. The team of people who will be looking after a person with schizophrenia will include a psychiatrist who provides medication. The first signs of schizophrenia usually will appear between your late teenage and the mid-30s. The active phase of the disease may last for several years or even up to a decade. This can be quite an alarming period for you or for your loved ones, but it's often followed by a less stormy phase where your more intense symptoms like hallucinations stabilize. But other symptoms like a loss of interest, troubles in thinking, and relationship problems are more likely to linger on. Now, nearly 50% of people who have schizophrenia recover or they improve up to a point where they can work, where they can integrate back with their families, with the society, and have an independent living. They have nearly a normal life with the support of regular medication. Around 25% people are better, but they need help from a stronger support network to be able to get along with day-to-day hassles of life. A small figure of 15% are the unfortunate ones who do not improve a lot. Most of these people will require supports in the form of hospitalization, inpatient care, and rehabilitation. Long-term success depends upon a number of factors. It depends upon how well you did in the society and at work before your schizophrenia symptoms had begun. The amount of time from the start of symptoms to the time of diagnosis and treatment. So people who are well integrated in society initially before the onset of the disease, people who have a very well-adjusted personality, people who were doing pretty well in their work life, in their academic life, or in their family lives, where the adjustments are good, the likelihood of a better prognosis, a better response with medication, with the support systems are also expected. Secondly, depending upon how early the disease was identified and how quickly the right treatments were given to a person, the prognosis would vary. A lot of times, people with schizophrenia keep delaying medication onset due to a lot of myths around antipsychotic medication. At the same time, persons who are suffering from this disease due to the lack of reality testing, which is a basic inherent part of the disease itself, will also resist starting treatment. There are times when the family wants to bring them into medication and therapy, but the client, the patient is resisting a lot due to a lack of understanding, a lack of personal and social judgment, or due to deficits in their reality testing. But once medication is started, majority of people with schizophrenia will show a good response and life becomes really livable, really easy, along with the family and in the society. Now, when schizophrenia is under control and the symptoms stop or the symptoms get better, it can be very easy for one to think that schizophrenia is behind you. And that can make one reluctant or avoid medication. But then relapses can happen. That means symptoms can come back. One can prevent the symptoms from coming back. One can prevent the relapses by watching out for the early warning signs. A good stable recovery from schizophrenia depends upon a good mental health support system around the patient who is suffering from this disease. Family support is very essential in order to maintain regular review visits with your psychiatrist or with your psychologist. Family intervention is also required to keep a healthy emotional balance in the life of the patient with schizophrenia. Families also play a very important role in dislodging the myths and misconceptions about the medication and helping the patients take the medications regularly. So, control and victory over this disease requires a multimodal treatment approach with a team of people experienced providing treatment on evidence based approaches, along with the support of family and society to help the person reintegrate. I hope this knowledge about schizophrenia is useful to all the people and families who are struggling with this disorder. So, on the World Schizophrenia Day, once again, I recommend people with schizophrenia to come out for treatment and their families to support them in their pathways. Thank you.